Hey, Team BCN. Thanks so much for joining me for today's podcast episode. For Women's History Month, BCN honored 5 women who were nominated by their peers as women who embodied CARE, that is compassion, accountability, respect, and excellence. In this episode, you'll get to meet Jennifer Curtis, Sue Snider, Ann Gililland, Rhoda Cheggeh, and Kathy Yates, and learn a little bit more about who they are and the work they do on Team BCN. You can also read more about each one on the Team BCN blog. And now, let's listen to my conversation with our BCN Women of CARE. Jennifer, thanks so much for coming on the podcast today. I'm so happy to get to talk to you.
Thank you, Heidi. It's an honor to be here.
Absolutely. Absolutely. So you are the volunteer and community liaison for the Bluegrass Hospice Care Center in our Lexington location. Tell me about your role and the work that you do at Bluegrass Care Navigators.
Well, our role is exactly how it sounds, a volunteer and community liaison. So we are the ones that work with our volunteer team, these amazing, amazing people that volunteer our time for BCN. And we also go out into the community to speak with different organizations, church groups, veterans groups, to let them know about BCN services and our mission, and also about volunteer services and how to get involved.
Absolutely. Absolutely. I think you're the first person that I've talked to that said my title is exactly what I do. So that itself is amazing. How long have you worked at Bluegrass Care Navigators?
In May, it'll be 19 years. It's gone by very quickly.
Wow. That's really awesome.
I was just a baby.
Of course. Of course. Weren't we all? For you, what is the best part about working at Bluegrass Care Navigators?
Well, that's easy. And you know what I'm going to say. It's the people I work with. The people that I work with have become really a family, a home away from home. A lot of us are with the people we work with as much as we are with our family. And I've had the opportunity to work with some of the most amazing people that are still with us and have gone on to do other things. And our volunteers come from all backgrounds, and it's remarkable what I see them do, and just to be a small part of helping facilitate what they do. So it's the people that make you stay, the people that are following that mission that makes it worthwhile. And that time spent away from your own family is the family you develop here at BCN.
Absolutely. Absolutely. So as we're celebrating Women's History Month and honoring our Women of CARE, who are some women who have mentored you along your journey?
Well, I know you mean BCN women, and of course, my own women in my family, amazing grandmothers who actually passed with BCN. I've been really fortunate to have all this tribe of true Southern women that are strong and amazing, and women that I've met in BCN. BCN has a long history of having women involvement and strong women in leadership, and there have been so many. There's so many. The ones that are currently in BCN, I'm sure they know who they are. Gwen Johnson has been an amazing mentor to me when I was her administrative assistant. My current supervisor, Shelley Brown, has mentored me in so many ways. We've known each other a long time in BCN, helping me support me as I got my CVA credentials, which I'm very proud of. And I work alongside Melanie Hagan every day, who I learn from every day. We're kind of called Lucy and Ethel, but we work well together. We're different and the same. And I'm so fortunate to be a part of her family and be on her team, that I learn so much from her every day as well. But of so many BCN women that I've gotten to become friends with that are like my own family, that my family has actually gotten acquainted with as well. So just amazing, amazing women that I've met along my time here.
For sure, for sure. What legacy do you hope that you're leaving through the work that you're doing and or by mentoring other people?
Oh, wow. That's a question. Legacy. You're making me feel old.
I'm asking it to everyone who is a woman of CARE, no matter their age. It's just because I think at any point, it's good to think about what we hope to leave other people, whether we change jobs or, something else.
Absolutely. That's a good one, especially as a mother.
Mm-hmm.
I think about the legacy I leave with raising my sons. I'm in an all-male household. Even my dog is a boy. So as far as just legacy at BCN, I hope exactly what it says. I hope that I have been a woman of caring when I have worked with our patients and their families, and the volunteers and our staff. I hope I have been compassionate and caring in my interactions. I know sometimes our work is busy, especially in volunteer services. Our work it gets challenging and frantic, probably more so than people think. And I hope that in those times of stress and wanting to get the care out to the patients, that I have done that with compassion and care. As far as legacy, gosh, I hope I have a long time left with BCN. So I hope I have a lot more time to work on a legacy. I hope that more people realize the importance of the volunteer program, what all they do. And if I could leave any legacy, I guess it would be how essential that the role is of a volunteer liaison, that profession, and the work that the volunteers do for us. But I think sometimes we maybe just take for granted they're always there and they're dependable, and how extraordinary it is that they do all this out of the goodness of their heart for free.
Yes, that is amazing in and of itself. Jennifer, we have had a lovely conversation. Before I let you go, is there anything else you'd like to say that we haven't already talked about?
Well, that I'm very humbled by the honor. Don't know that I'm deserving, but it's very much just that. It's an honor. I love that we're spotlighting I'd love to spotlight all the women of BCN. The care that we go out with our team. I think it's really wonderful to work for an organization that is so supportive of women and have been from the very beginning.
Absolutely. Absolutely. Well, thank you so much for taking the time to hop on the podcast, and congratulations on being named one of BCN's Women of CARE.
Thank you, Heidi.
So, thank you so much for taking the time to come on the podcast today. I'm so happy to get to talk to you and celebrate the Woman of CARE award with you. Thanks for coming by.
Well, thank you so much for having me.
Absolutely. So, you've worked at Bluegrass Care Navigators in many roles and currently are the clinical operations and project specialist. Would you tell me about the work that you do now?
Yeah, my title is actually Senior Administrative Project Specialist,
Okay.
and it's really a fancy name for, hey, Sue, can you do that? And about 99% of the time I can. So I actually report to clinical administration, but they loan me out to a variety of departments. So I've worked for CQI, helping them cover during the COVID pandemic because it was such a busy period for them, and to give their staff a break or to catch up on work. They would call me up and I would periodically work for them. I work for various departments in the clinical administration. I've done a little bit of like when Compass started, helping with that transition, moving from Suncoast into Compass. And those types of projects. Right now I'm working for a CQI. So many of the projects are when someone is either taking some PTO time, or in this case, someone has been promoted to another role. And so I'm covering until the position is filled.
Yeah, that makes a lot of sense because in your career at Bluegrass Care Navigators, you've done a little bit of everything throughout your years here, right?
Yeah, I've been just celebrated in January my 20th year. And so when I started, the organization was very well, I mean, I don't know if small is the word, but medium size. We had about 500 patients, and we didn't have Pikeville at the time. We did not have the hazard inpatient unit. The hazard office was much smaller and in a very small location. And we didn't have Corbin or Barberville at the time. So many of those offices had not transitioned with us yet. So I help with all those transitions and helps. Well, Monica did most of the inpatient unit startup, but just clinical operational things with her. I've worked really, really closely with Monica over the years. So yeah, I've done a variety of roles. Our education department was extremely small, so I did many of those projects. So yeah, there's been a variety of things
Yeah.
that I've done.
Yeah, absolutely. So, as we celebrate Women's History Month in March, and we're also highlighting our Women of CARE, of which you are one, who are some women who have mentored you along the way?
Well, I've just had so many folks that have mentored me. that I could name. So I'll try to keep the list short, but
Okay.
yeah, that's hard. One of the first nurses, and I want to point this out to our nursing staff, one of the first nurses I had, her name was Kate. And I was a brand new nurse. I was 30 years old, and so I was a little bit older. I'd already had a career in social work. By the way, I have a background in social work and chaplaincy both. So that's part of why I'm kind of the interdisciplinary team at hospice. I have a master's degree in social work and a master's in nursing.
Wow.
So Kate really helped me hone in my documentation. And sometimes that was not a fun job to do. There are things that you've got to give feedback to that sometimes it's difficult. But Kate didn't hesitate to point out things that I needed to improve on. And looking back on it, it wasn't very long how much I appreciated that feedback. It was difficult at first, but then I really grew in knowing how to document better and how to get my timing down.
Mm-hmm.
So sometimes those difficult conversations around our careers are very important. My partner, Sandy Mathis, has been a nurse for 50 some years. And Sandy was quite the mentor and really helped me start out in my nursing career. I may not have pursued it at all had I not had that encouragement.
Mm-hmm.
Karen Stefaniak was another mentor. I worked with her at UK, and she's still teaching at the College of Nursing at the University of Kentucky. And when I started doing the hospice liaison nurse at UK in 1994, and she was quite the mentor. I knew about university life because I'd worked at the University of Texas medical branch, but I was in a very different environment at UK. And Karen was such a great mentor to me, encouraged me to get both of my master's degrees, and actually wrote an article with me on nursing. So it was quite a mentorship there with her. And then Janet Snap, who was at our office and I've known for many, many years, was also a very, very good mentor to me. And I like to think that I mentored her as well.
Absolutely, absolutely. It's wonderful to be mentored by people. It's wonderful when it's a two-way street as well. That leads me into one of my next questions. What legacy do you hope you're leaving, either through your work or by, as you've already said, mentoring other people?
Well, I've mentored many, many nurses across the organization. I think formally and informally,
Mhm.
I've had many nursing students across the ages, and some of those have come back to tell me how much that's meant to them. So I think that nursing expertise over time and sharing that expertise and being available to people. I still occasionally get calls from different departments at UK sometimes that have become friends over the years, and they've reached out and asked me questions about hospice and how do they get a relative perhaps in, or a friend or a church member.
Mhm.
So I like to think that I've really mentored folks along the way, but I think my legacy really is the 29 years that I have been working in hospice care. And of course, 20 of those being at our own hospice here. I think that demonstrates my years of commitment to our staff as well as to patients, not just, I mean, across the Commonwealth. When I think about the overarching effect and impact that our nurses have had taking care of our citizens of our Commonwealth, I really like to think that my legacy is that of reaching out across the all of our counties and providing excellent hospice care, doing the very best we can for our nurses. I think part of my other legacy is both my kindness and my compassion and my passion about hospice. It's so apparent. People tell me after I've done a speaking engagement how passionate I am about hospice care. And I think the other thing is my humor. Most people will tell you that I have a very good sense of humor And I try to even integrate that into some of my presentations. I think it's good to laugh and to share that bond with others when you have a sense of humor.
Absolutely. Absolutely. All of those wonderful things to share with other people through the work that you do. What is the best part about working at Bluegrass Care Navigators?
Well, I think the best part, number one is our legacy. 45 years of helping people across the Commonwealth of Kentucky and their families to die well and to die without symptoms and die in the way that they want, to follow their wishes. A friend of mine used to say that Bluegrass Care Navigators, we were the Burger King of healthcare because we allowed people to do it their way.
That's true. That's true. So this has been. I'm sorry. Go ahead.
I was just going to say the other thing is our people. Our people are so fantastic, and working in a team is just such a joy. And so that my best thing about working at Bluegrass Care Navigators.
Absolutely. This has been a wonderful conversation, Sue, and I've really enjoyed the opportunity to get to know you a little bit more. Before I let you go, is there anything else you'd like to say that we haven't already talked about?
There are just so many things that I could say, but I think I've shared the most important parts, Heidi. So I appreciate your conversation with me today.
Absolutely. Absolutely. Well, Sue, thank you so very much for your time today, and congratulations on being one of our Women of CARE.
Well, thank you so much, Heidi.
And welcome to the podcast. I'm so happy that you're here.
Thank you so much for having me.
Absolutely. Absolutely. I've enjoyed getting to talk to each of our BCN Women of CARE. So you have worked at Bluegrass Care Navigators for 6 years now, and you are an RN and the Bluegrass Transitional Care Screener. So if you would, tell me a little bit about your role and the work that you do at Bluegrass Care Navigators.
Well, basically, I screen for eligible patients for different types of programs that Transitions offers. There's 3 programs that we mainly enroll patients in, and one of them is the Transitional Care Program, and that provides support and education for patients. And we have patients that are infants to elderly that we enroll, but it provides a home coach to come see them after they go home from the hospital for support and education. The next one is a hotel respite program for the homeless here in Fayette County, and that is a grant-funded program through Fayette County. And then the third is the dementia program, which is another grant-funded program for patients and their caregivers who have Alzheimer's or dementia. But I go in and see patients here. I mainly see patients in UK Chandler and also UK Good Sam and enroll them in those programs.
Okay, that's awesome. That's really awesome. So as this month of March that is drawing to a close, but it is Women's History Month. And so we're obviously honoring and celebrating the women who have gone before us and who work alongside us to help make us who we are today. So who are some women who have mentored you along the way?
Well, my number one mentor is my mom. She instilled just some core values, mainly being honest, being accountable for my actions, being kind, and being hardworking. She's probably the hardest working person that I know out there. And to this day, she just gives 110% to anything that she does. And so I just am just so lucky and blessed to have her in my life.
Mm-hmm.
Professionally, I had she actually was my boss, and she was an owner of a home care agency. But what she taught me was the value of teamwork and how important it is that each and every one of us plays an important part, and that it takes all of us to make it successful and to help that patient in any needs that they may have. And so just having that teamwork, she instilled that in me. And I'm just so grateful for her for that. Now with Bluegrass Care Navigators, my big mentors were the hospital coaches that mentored me was Rosa Campbell and LaQueta Hume. And they taught me everything that I needed to know to be successful. And they helped me grow professionally And just to this day, LaQueta Humes went on to the PACE program, and we miss her terribly. But Rosa, she's somebody that I can bounce ideas off of, and it's so great to have her on my team. And I just feel very blessed to have both of them to teach me, that have taught me so many things.
Absolutely. And what a blessing to have a mom who taught you from the very beginning, and good parents are such a gift. And then to have people come alongside you professionally as well. So thank you for sharing about those people who have impacted you. What legacy do you hope that you're leaving for others through the work that you do, or personally? How do you hope that you're impacting the world?
Well, I just hope that I make a positive difference in everybody's lives that I meet. That's probably the biggest thing. And also in regards to transition, I hope that mentoring others along the way, I hope that I can teach them and give them a good foundation to help transitions continue to grow and to allow more patients to be seen and to be helped as much as possible.
For you, what's the best part about working at Bluegrass Care Navigators?
Well, of course, the patients that I meet along the way, but really the team that we have with transitions. It is a fabulous team from the top to our home coaches, who I just love and adore. I just appreciate everybody that's involved, the hospital screeners here that help me along the way. Just a good support system for one another that we can just talk back and forth. If we have a question about something, you can say, hey, this person knows something. Or if it's a social work need, you might be able to ask the social worker for help. Or if it's a nursing need, you might be able to say, hey, what can you help me with to help that patient to get the best care that they deserve and need?
That's one thing I've noticed. You've been here 6 years. I've been here about 6 months, but I can just feel that difference and that more supportive environment. And it's a beautiful thing.
It is a very beautiful thing. And we are very blessed and lucky to have that. But it's a foundation that started from the get-go, and they've just built on, and I just feel very lucky to be a part of the organization.
Absolutely. And this has been a great conversation. Before I let you go, is there anything else you'd like to mention that we haven't already talked about?
I just want to say thank you for this opportunity. I just feel very honored.
You're very welcome. From what we have yet to meet in person, which I hope we get to, but from what I have read about you, this award is very well deserved. So congratulations.
Thank you.
Rhoda, thank you so much for joining the podcast today. I'm really looking forward to the opportunity to get to know you a little bit more.
And thank you for having me. I really appreciate.
Absolutely. You're our chaplain at the UK and Baptist Health Lexington locations. Would you tell me a little bit about your role and the work that you do there?
When I started with the BCN, I was a home team chaplain, but after couple of years, I was transferred to the IPU. And so right now I'm covering UK, IPU, and Baptist. And in UK, we have our own unit where everybody's a hospice staff. But in Baptist, we call it scattered beds, where the floor, the hospital staff still take care of their patients, but we are there. We are support. We are there on top of our patients. And so we go everywhere. So I'm a chaplain to both places, UK and Baptist.
Wow. You have a busy job, and I can hear in the background that you must be in the hospital today.
I am in Baptist today.
Absolutely. How long have you worked at Bluegrass Care Navigators?
This July, 1st July, to be 15 years.
Wow. That's a really long time. So what is the best part of working at Bluegrass Care Navigators for you?
For me, it is natural. I love working with people who are, let me say, not vulnerable, but people who are in this condition. I love working with the patients and their families. I just walk alongside them, not to fix them, but to walk alongside them as a support and just to comfort them, knowing that my mom was in the same condition and passed away. And so I have somehow, I can feel with them, and I know where they are, having a loved one who is just about to go. So yeah, that's why I love what I do for our patients and their families.
Yeah, it gives you a lot of empathy for them too, I would imagine. Yeah. So for Women's History Month, we, as you know, Bluegrass Care Navigators awarded 5 Women of CARE to kind of celebrate them and this month. So who are some women who have mentored you along your journey, either personally or professionally?
I have several. I have several of them, starting the first one, maybe being my mom, who I emulate even now that she's gone, telling me that it is very key to empathize and to stand with the people who are vulnerable, who cannot be able to stand for themselves, to be their voice. So she's among them. And of course, now when I came to hospice, I had several mentors who mentored me. One of them was called Carol Green, who was like our instructor, because I took my units, the 3 units here in Bluegrass Care Navigators. And she was my mentor, and I followed her. And it has been every time, whatever I do, I remember what she taught us, how to be present. So, yeah, I can say I have several mentors, but one of them is Carol Green, who was my instructor when I came to Bluegrass Care Navigator.
What a gift to have not only your mom, but somebody in your place of work to just kind of walk alongside you and teach and help you.
Yes.
So, as we think along those lines, you've been at Bluegrass Care Navigators 15 years. So, you're now in a position to kind of train and teach other people, both personally and professionally. So, what legacy do you hope you're leaving through the work that you do, or maybe by mentoring some other people?
That is really good. For me, when I look back, I would like to leave something behind to the younger chaplain who are coming up, just to know who they are and their position, regardless of education, but the life that they live, because, the action speaks louder than words. Just for them to be there, I'm trying to pass on to the younger ones who are coming in as a chaplain that our presence means a lot. We find people who are broken. They don't know what to do. This morning, I was in a room and they just asked for a prayer, and the daughter broke down. She started crying just because of the prayers, just bringing them in the scene, to be there with their mom who is about to go. So my legacy, I just want to leave them that they can remember she was there, her presence, her touch, and whatever she said, that was, my words that may go beyond me, just for them to remember that there was somebody who could sit with a patient who is going and hold hands, sing for them, pray with them, cry with them. That's the legacy. And I would like to tell the others who are younger, your presence means a lot. You don't have to struggle. You don't have to fix anything, but just present, be there, a true present there, because even the person who is sick can tell you are there. You're not, that's the legacy to live. Yeah.
Yeah. Presence is a beautiful gift, right? And sometimes we think we have to say something or do something, but just being there is such a gift to people.
Yes.
Yeah. Rhoda, I feel like we could continue talking for a while, and we've had a beautiful conversation. Before I let you go, is there anything else you'd like to mention that I haven't already asked you?
Actually, no, but the only thing I can say, thank you for what you do, because it enlightened others what a hospice does, because some people, they know just the word hospice or Bluegrass Care Navigator, and some they rule out and think, oh, when you hear hospice, it's death. No, there is more than death. There is life. We come here to support, to walk alongside, to love on these dear patients and their families. So we do more than death. We are just here. And not only that, after the death, hospice has opened another door that called bereavement, where somebody can come and sit down and just explore what they are going through, and hospice will be there for them. So we are more than death. We are more than just being the name, but we can do more for the families as well as the patient who is going home.
Absolutely. We're hope as well. I love that. I love that.
Yes.
So, Rhoda, thank you so much for your time today, and congratulations on being named a BCN Woman of CARE.
Thank you. Thank you so much.
Kathy, I'm so happy to get to talk to you today. Welcome to the podcast.
Thank you, Heidi. It's a pleasure to be here.
Absolutely. I'm excited to get to know each of our women of CARE. As our PACE Center Director in Lexington, would you tell me a little bit about your role and the work that you do?
Sure. PACE is a brand new program to the state. We were the first PACE program to open, so that was very exciting. And at PACE, we all wear many hats. Some days I'm the director, some days I work in the clinic, some days I am vacuuming. We do laundry, we work in the kitchen, we prepare food for the participants. We spend time with the participants. One of the greatest things that I enjoy doing is I do all of the ladies' nails once a week. So they have an opportunity to look down and have pretty nails, and they appreciate that. And we get to chat and talk. And it is truly a pleasure to spend time with participants. It's been quite a while since I've had that opportunity to spend that much time with participants. And it took me a while to learn to call them participants and not patients.
Why is that a distinct difference?
It is a distinct difference because I've been in management for a while, and it does take away your ability to spend time with those you are serving in the patient participant capacity. So it's been a welcome change.
Awesome. Awesome. How long have you worked at Bluegrass Care Navigators?
I was hired in the beginning of the pandemic in May of 2020 as
wow.
the executive director for the Lexington Hospice.
Wow. Wow. What a time to start a new job, but we're very glad that you're here.
Thank you. Me as well.
Yeah. For you, what's the best part about working at Bluegrass Care Navigators?
The best part was the atmosphere. I had come from an organization that the atmosphere was not the welcoming atmosphere that BCN promotes and has. They say they have it, but it truly is an organization that promotes compassion and amongst their employees. It is a family atmosphere, and it is truly a wonderful place to work.
Absolutely. I couldn't agree more. So, as you know, March is Women's History Month. And so that is one of the things that we're talking about this month. And we're honoring women, but we're also celebrating women who have mentored us and helped us get to where we are today. So, who are some women that come to your mind who have mentored or influenced you along your journey?
So I have three who they've had a distinct role in my development throughout the years. First was Molly Brumfield, and she was a nurse who was on the oncology unit that I worked on for. I either did inpatient oncology or outpatient oncology for 17 years in Huntington, West Virginia at Cabell Huntington Hospital. And she was a nurse who taught me what excellent patient care looked like. She encouraged me and others to participate in the clinical ladder that the hospital had, and I achieved the highest level that a nurse could at the time, and also encouraged me to become oncology certified. So we all went as a large group and took the hardest test I've ever taken and oncology certified nurse. And she was not only a good friend, but a great teacher.
That's awesome.
The second is she was the director of Care Tenders Home Health, where I worked for 10 years in Richmond, Kentucky, and her name was Sherry Powell. And she is who taught me what an excellent teacher and what an excellent leader could be. She taught me how to do OASIS assessments and to get out and work in the community with patients, because that was completely different than anything I'd ever done in nursing. And it just clicked for me, mainly because you got to develop a relationship with patients, and you developed a relationship with your coworkers. And she showed what a family-like work atmosphere could be. And she led by example. She promoted wonderful positivity and hard work with a caring attitude. And she was wonderful.
That's awesome. Who's your third?
My third is Stephanie Green. And Stephanie Green was in leadership in care tenders for many years. And I worked for her, and she showed me how you can lead a team of people with compassion and respect. And I had many leaders who led with fear, and I always knew that if I were to become a leader, that Stephanie would be one of the people who I would want to most be like. And she proved that you can be thoughtful, and you can be respected and not feared. And you can do that while having a really good sense of humor.
That is really high praise for every woman that you've mentioned. And what a gift to have been influenced and to be around this type of woman.
It was three really great women in healthcare, and I couldn't have asked for better mentors.
Absolutely. Absolutely. As you think about your own legacy, either personally or professionally, what do you hope that you're leaving? What impact do you hope that you're making on others?
The legacy that I want to leave in my professional life is the same as my personal life. And that is treating people with kindness, compassion, respect, and honesty, with a little bit of laughter thrown in here and there. I want people to remember, people don't remember what you say, but they do remember how you make them feel. And I think that I've made people, not only in taking care of patients and participants, but in being a leader myself, that I have made them feel special, worthy, and how much that I appreciate the fact that they're here working alongside me and everyone else to provide the best care possible. But I think I want to be remembered for being a servant leader. And you serve those you work with and for. And just for me personally, being the hands and feet of Jesus. And that's my motto, and that's the legacy that I want to leave.
I love that. I love that. Kathy, I really appreciate you sharing today. Before I let you go, is there anything else you'd like to say that we haven't already talked about?
It just was a thrill to be nominated for this award. And after a 30-year career, it makes me feel good that what I'm doing, I guess, is I'm on the right track in what I'm doing. You'll have a lot to learn, but I very much appreciate this honor.
Absolutely. Absolutely. So well deserved. And congratulations on being named one of our Women of CARE.
Thank you, Heidi.